Very good evening. You're watching the India Development Debate. I'm Tamanna Inamdar. Our big focus today continues to be the spread of the novel coronavirus that has officially infected 29 in India. Meanwhile, deaths worldwide have crossed 3,000 and the numbers of those infected at above 90,000. In a short while from now, I will be joined by Soumya Swaminathan, Chief Scientist at the World Health Organization, who will answer all of our questions and those of viewers too on the coronavirus. We will also be looking at how the RBI could respond after central banks across the world have followed the Fed's cue and taken measures. It's of course been a newsy day, and the other big story we're looking at is the new lease of life for cryptocurrency after the RBI circular virtually banning them has been reversed by the Supreme Court today. And as we kick off Women's Day celebrations, I speak with Seema Verma, a single mother who turned her life around and went from domestic worker to marathon runner. All of that up ahead, but first the latest on coronavirus. Italy has now banned hugging and kissing as numbers continue to increase. In India, all incoming travelers will be screened, not just those from certain countries, and a Paytm employee in Gurgaon has tested positive. Meanwhile, while top government functionaries, starting from the PM, have announced that they will not be attending holy gatherings as a preventive measure. So as panic spreads even faster really than the virus, the need of the hour is to get credible information. So as the country prepares for the outbreak, we bring in you voices that you can trust instead of rumors being widely circulated, especially on social media. So joining us today to answer some of your questions, and of course many of ours, is Dr. Soumya Swaminathan, Chief Scientist at the World Health Organization. Dr. Swaminathan, thank you so much for speaking with us here on the India Development Debate. It's truly a pleasure. Just first, let me begin with the very basic. The question of how deadly really do you think or see the coronavirus as being? Because the general perception is that the fear factor is possibly causing more damage. There's supposed to be a 2% mortality rate and the elderly are supposed to be most vulnerable. Would you then classify this as not such a deadly disease?
Thank you. Yes, I think this is a very important issue in how we communicate about this disease to the public, because after all, it's a new disease, it's a new virus that the world is seeing for the first time, and therefore there naturally are high levels of anxiety because of the uncertainty around many aspects of this disease. But we've learned a lot. We know a lot. In the last 2 months, there's been an enormous amount of information that's been generated. And as you just mentioned, what we've learned from the outbreak so far, mainly from the work that's been done in China, is that about 80% or so of infections are mild, very little symptoms, just need symptomatic management, and they are fine. Another 15% or so get more severe symptoms and may need hospitalization, and a small percentage, 4 to 5%, may end up with critical illness. And as you mentioned, the mortality is between 2 to 3%. But this again, we've seen the mortality rates are different by country, different by region. So I think there are many factors affecting the mortality rate, and we can't yet be entirely sure because we also don't know what the numbers of infected people are. So as of now, yes, between 2 and 3%. I would say that, communication is important. The words we use are important. We should stop calling it a deadly virus, a deadly disease. I've seen many media channels using this word. I think that instills more fear in people. It's not deadly. We have many more other deadly infections that have much higher mortality rates. Vast majority of people here are going to have a mild illness. The second thing is that, Tamanna, we've coined a word called the infodemic. So on the one hand, we see the outbreak or the epidemic caused by the virus, but on the other hand, you have this information epidemic, which is mostly misinformation and rumors and false information. And this actually is an infodemic which is interfering with the response to the outbreak. So it's responsibility of all of us who are talking to people to convey the facts. And like our DG said, it's a time for facts, not fear, and it's a time for science, not stigma.
Infodemic, I think, is such an apt term. I'm going to, liberally use it, if you don't mind, because I think that's exactly what we're going through. But we've asked our viewers for some questions for you. Many of them are FAQs. So if you allow me, let me put some of them to you. And I think this is what many people want to know. So there is a query from Dr. Nofil, who is asking, how can we distinguish normal cough and cold symptoms from coronavirus symptoms? Now, I'm not sure if this is a medical practitioner who's asking this question, but at this point, it's possible that a lot of local doctors who are the first contact for patients do not know the answer to this question.
It's a valid question, and it's difficult to answer because the symptoms are really more or less the same. So the most common symptoms are fever, a dry cough, and fatigue, and then shortness of breath in those where the disease progresses a little bit. There really is no way of differentiating this from any other acute respiratory infection, upper respiratory infection. So at this point of time, I think we have to also rely on local epidemiology in order to put two and two together. So if you have symptoms and you've been exposed to someone who's traveled, or you've traveled yourself to one of the places where this infection has been documented, then perhaps you're at higher risk. At the moment in India, there isn't enough data that there's widespread community transmission going on. And so everybody who gets a fever and a cough should not worry that they've got this new virus. Things change from time to time. So as I said, the risk in a particular place depends on the epidemiology in that region. And for now in India, all cases have been linked with travel to one of the affected countries.
Talking about India, we've had sort of a lull. We had 3 cases a few weeks ago, which then, they were in quarantine and discharged. And then now suddenly in the last 24 to 48 hours, you have this sort of explosion, more and more cases coming to the surface, which is causing fear and panic. In your view, is the Indian medical system prepared for a big increase in cases? Is there a likelihood of a lot more cases coming up, considering it's a densely populated country? And I'm sorry, I'm adding so many questions all together, but there is a widespread belief that because it's generally hot, the virus won't really affect us. Our immunities are higher. What is your response to all of this in the Indian context?
These are all, very relevant questions, not necessarily we have answers to all of them. The epidemiology is changing. We're in a new phase of this disease. Initially, it was China, it was localized. It was either you live there or you travel there or you're in contact with somebody there. It was very clear cut. Now it's much more diffuse. It's much broader. It's in over 75 countries. And there are many other hotspots now across the world. And so, so the travel history to the countries has also expanded, in terms of being a risk factor. India, like all other countries, is at risk, and WHO has been saying from day one, countries must prepare. Every country is at risk, particularly those where there are weaker health systems. Within India, we have a variety of health systems from very strong to weak. And therefore, we now have to ensure that every state and every district is prepared and has the capacity, the knowledge, the resources, the infrastructure, the kits to be able to respond to this. Now, let's hope that it's contained, because we're still at a phase. We have to also recognize the fact that we're still at a phase where this could be contained and it may not become a generalized epidemic. But at the same time, we have to prepare for a possibility that it could go beyond, that it could start affecting much larger numbers. And what do we do in that case? I think we're at a stage, at a very decisive moment, at a critical moment, when you have to focus on containment while at the same time preparing for a situation where you'll move into more mitigation and response.
So As far as screening and then possibly containment is concerned, the biggest step so far is screening everyone at the airport, which has started from yesterday or today. So far, we've been screening passengers only from certain countries, and I think that's why a few slipped through. How effective is this screening? Because as I understand it, this is a thermal screening. So a potential patient will show up only if they are in the phase where they already have a fever. What if they're asymptomatic at that point? Is it possible they pass through the screening and then come and develop symptoms and then can also pass it on?
So thermal screening is going to pick up people who have fever at that point of time. So it is not foolproof and it's not fully sensitive. Obviously, you can walk through without fever and you can go home or to a hotel, and then next day, the day after, you can still develop fever. So I think it's really important, apart from the thermal screening, is to ensure that all travelers get the required information so that if they get sick, they need to know where and how to report and where they could be tested. So I think that follow-up action would also be useful to really make sure that we're not missing any undetected infections.
The other question, of course, that everyone has is about the level of precaution to take. And Bhavya Singh has written in where she says, how can we just stay away from the virus? Ditching public transport is not possible as working professionals. So everyone has been told don't go to crowded places. In fact, the Prime Minister said he's not attending holy functions. A lot of people are wondering whether to celebrate the festival in large congregations right now. So will that help? Just staying away from public places, and especially things like public transport. I mean, the Mumbai trains are notorious for the number of people packed in. So those are really real fears. People can't take taxis or private transport every day.
Absolutely. We have to look at the practical aspects, right? People need to go to work. They have to earn a living. So I think we need to take, so this is where I think we have to have a sensible and a practical approach, whereas we encourage people who are sick to stay at home and not go out into trains and buses and office spaces which are enclosed. So all workplaces should give people a couple of days leave if they're sick to stay at home. If you have a cold and cough, don't venture out. And if you have a cold and cough and you have to venture out, wear a mask and take all precautions so that you're not coughing and throwing out sputum in public places. But for people who are well, should go about their normal life. But perhaps take certain practical decisions like, are there gatherings that can be avoided? Knowing that we have this outbreak happening, it may be good practice to, wherever possible, avoid gathering in large numbers. Now, this doesn't mean that you don't celebrate a festival, but perhaps you do it at home with a smaller group of friends and family, rather than go out and be with thousands of other people. So I think voluntarily one can do these things wherever it is feasible, where it's not essential. But when you have to have essential travel, essential to go to the market, to go to work, then I think it's important that people who are sick should try and stay away. Now, it could be just another cold, or it could be influenza or something else they're suffering from. But in any case, it's good practice, if you have a respiratory infection, to keep yourself away for a couple of days till you're better.
Medication and treatment is the other concern a lot of people have. So here, let me bring to you Jay Desai's question. And he asks, if I have cough, cold and fever and the doctor prescribes me regular medicines, will these also suppress possibly coronavirus symptoms or delay the virus's detection?
It won't delay the virus's detection. What it will do is it will suppress symptoms. So if you're taking an antipyretic, if you're taking paracetamol, for example, it will relieve your fever, your body ache, and your headache, regardless of what the cause is, what the infection is. So, and you should go ahead and do that. And in fact, majority of people with this infection also are only going to need those symptomatic medicines. They're not going to need anything more than that. And that's not going to interfere with the detection of this infection. It's only if things get worse, you start having breathing difficulty, shortness of breath, etc., severe fatigue, then, or you really start feeling unwell, is the time to go into hospital and seek care from a doctor. But otherwise, symptomatic treatment, paracetamol, painkillers, etc., is what would be used in any case.
A couple of more questions, Doctor. One is, what's your sense? This was supposed to be something which will peter out by the first few weeks of March. Looking at the pace it's gathered, do you think that that's still possible? Is there any precedent which tells us how long this cycle will last? Because we've seen SARS, MERS, H1N1, things like that have a life cycle and then they sort of peter out. Do you think that will happen with the COVID-19?
So first of all, we can't make those predictions because we don't have the data. And it's very dangerous to assume that this virus will not survive in the hot weather and therefore we should be all right in India or in other countries which are hot and humid. It would be dangerous to assume that. So one needs to prepare for a full-fledged attack of this virus. And if it doesn't happen, then we should be happy and thankful, but can't rely on the fact that this virus will not survive in hot weather. There's no evidence to that. Secondly, I think about how this is going to turn out in the long term. I think we still need to do everything we can to contain it and to make sure that it does not become a generalized epidemic. So the focus needs to be on public health measures of detection, of good surveillance, of isolation of those who are infected, of quarantining some of the contacts, of tracking the contacts and making sure that they are all well, and of providing the right information to people so that they can also take care.
Yeah, I must ask you one last question, and I know it's a very busy time for you, but just one last question. A lot of people are suggesting, and then there are governments, local governments as well, that are proposing homeopathy or Ayurveda or alternative medications as preventive tools. Is there anything to show that this would work, even as immunity boosters?
Regarding this particular virus, there is no information as yet on any known and effective therapeutic or preventive. Many clinical trials are going on in China, as well as now they've started in other countries, and hopefully India will also enroll patients into clinical trials for therapeutics, which will give us much needed information. And for prevention also, I mean, there is no harm in testing some of these proposed therapies. But the fact is that they need to be tested and proved that they are effective in either prevention or treatment. And it should not be propagated as a specific drug or treatment for this infection. The claim of some of the medicines being proposed could be that they are general immune boosters, and that may be the case. But it would be inaccurate to say that they will protect against coronavirus, and it may give a false sense of security to people. So trying to maintain a good immune system by having all your vitamins and minerals and having a healthy, nutritious, balanced diet is certainly good to keep healthy in any case. But it's not going to be specifically protective against any other virus. So I think that we need to have that clarity. And we need to invest in more research, both in epidemiological and clinical research, as well as in research on new therapeutics, diagnostics, and vaccines. And I think India has a lot to contribute in that space.
Absolutely. Thank you so much, Dr. Swaminathan, for your time and for speaking with us today on this very, very important issue, as well as for taking our viewers' questions.